So when you've just had a baby and you're kind of in the beginnings of it, it can feel completely overwhelming.
So yeah, without the help of the health visitors, I would be in a very dark place.
Here in Hampshire, before lockdown, we had provided face-to-face groups for women who were feeling low in mood or anxious, and those groups were called Knowing Me, Knowing You groups. This allowed mums who were feeling low in mood or anxious to come together and share their experiences and receive the support that they needed.
It was truly invaluable to not only listen to the content that the health visitors were delivering to help us with coping mechanisms and to understand why this was happening to us, and make us feel like we're more confident mothers and that we can do this.
Specialist health visitors in perinatal and infant mental health are experts in understanding babies' infant mental health and their development. If health visitors are able to support families quickly enough, it can have a huge impact on the mental and physical development of a child.
When lockdown was announced, I was in denial for the first couple of weeks, and then I went into complete shutdown, and the realisation that I no longer had that support network was horrendous.
We knew that if people were feeling isolated and anxious during this time, there were risks to the mums and the babies. We knew we needed to move quickly, and so by April we were able to set up groups in a virtual way.
When sort of the virtual group was confirmed, it was a real relief, because you kind of thought, well, I'm actually going to be able to do this.
We were concerned that mums and babies might feel tired in a virtual setting, and that meant that we had to revise the materials that we used to make sure that they were appropriate.
The delivery, it just seemed very professional and very, the same as it would be if you were doing it sort of face to face.
Overall in Hampshire, during lockdown, we supported over 45 families, and the feedback that we've had and the outcomes that we've been able to measure have been really positive in that time. I'm really proud of the work that all of our health visiting teams have done during this time to continue to provide support to families who really needed it in a very difficult time.
I can't thank them enough for what they've done for me, and I know everyone's experience is different, but they went out of their way to do everything and provide all the support that they could.